Enforcement Agency, EPA, and U.S. Small Business Administration, and Vital Incorporation, and the Fort Valley State University. Okay, thank you. Let's give him a hand. Now Ms. Thorne, she gonna love what she presenting, but with passion. But she ain't gonna take as long. She's gonna be thorough and brief. She's an excellent speaker, and she's been a great friend to you all, mayors. So just pay attention as you come. And you know, when we met, I said I thought we was gonna be talking about criminalization. I got on the Obamacare. I said I call it affordable health care. She says I read it from page to page and told me how many number of pages it was. So you finna get some. She called it the African American health care bill. So yeah, give a warm reception as she comes.
Good afternoon. Thank you very, very much. Can you tell me why a little black baby reaches its first birthday only maybe? Alcohol, poor nutrition, or cocaine somehow becomes that baby's middle name. Too little prenatal care is being sought. Too little health education is being taught. Can't we stop this dying months from the womb? Because too many black babies are leaving too soon. Can you tell me why this little black child hasn't been bathed or fed in a while? As a society, aren't we supposed to protect our children from dying from abuse and neglect? Too little parenting is being learned. Too little health education is being earned. When can we stop this sadness and gloom? Because too many black children are leaving too soon. Can you tell me just what is the answer to stop black women from dying of breast cancer? Is there any way to get the message across, because no more lives needs to be senselessly lost? Too few appointments for mammograms. Too few doctor visits for all health exams. Sitting beside my sisters in hospital rooms, too many black women are leaving too soon. Can you tell me just why a black man stands a chance of being shot, and why the man who killed him probably is a black man? Too few fathers, jobs, and good intentions. Too many women, drugs, and legal detentions. When can we stop singing the same sad tune? Too many of our black men are leaving too soon. So can you tell me just when the black race will put health in its rightful place, instead of keeping up with the family called Jones, making sure our health status is regularly known? Too much time is spent trying to impress. Too little time to take a simple blood test. So let us all please hurry and change these predictions of doom and stop black people from leaving too soon. Yeah. There's a health crisis in Black America. Black people get sick more frequently, we're screened for illness less often, we're diagnosed later, we're treated less aggressively, and we're buried earlier than any other ethnic group in this country. Back in 1966, the Reverend Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Here we are in 2015, and nothing has changed to a great extent. But we have now entered an era of unprecedented and unparalleled major transformation and overhaul of the American healthcare system. Things are never going back the way they were before. And quite frankly, the Patient Protection and Affordable Care Act now gives us the tool and the structure to strive for justice and equity in healthcare. These are the three reasons why this law was actually passed. Clearly, we have to increase access. One of the most dangerous ways of staying in poor health is to not have access to a doctor and have insurance. So that was number one. Reduce government spending. We spend $3 trillion on health care, and we're still dying from preventable, manageable disease in this country. And obviously we spend far too much money taking care of people who are sick, with diabetes, with heart disease, with asthma, all major forms of cancer, and they disproportionately impact people of color. Well, why do we need the law? Well, it's about economics. Poor people can't afford health insurance. Working poor people who go to work every day can't afford insurance. And quite frankly, people are using credit cards to pay for health care. It's bankrupting people. It's the primary cause for personal bankruptcies, medical expenses, buying drugs. Something wrong with that picture. So, our president decided that he was going to try and make a difference and change it. And many say, well, that was a career killer, to start overhauling the healthcare system. But look at the status of people of color and their health. All major forms of cancer affect African Americans the most. African Americans are 40% more likely to get high blood pressure and 18% less likely to have it under control. Black men have the highest rate of prostate cancer in the world, not just the US, the world. Clearly, we are the ones to benefit mostly from the Patient Protection and Affordable Care Act. So our president decided that he was going to try and make a difference. But you need to understand the context here in history. Because every president since 1912 has tried to fix the healthcare system. They've tried to make changes. They've tried to fix it and make it better. And you see all these faces, right? Well, let me show you the face that really made it work. It took him 1 year to bring into Washington the best and the brightest from both sides of the aisle and struggle for a year, hotly debated, definitely contested, to fix America's broken healthcare system. And he did it in a year. So that on March 23rd, 2010, the Patient Protection and Affordable Care Act was passed. And I always use that phrase, patient protection. It's not just about insurance. It's about patient rights. It's about making sure that you get quality care. It's about making sure that people treat you in a culturally respectful way if you get sick. And it's also about prevention, so that you don't get sick in the first place. Well, after the law passed, then it was a year of wrangling. Can you force people to have health insurance? Can you make them pay a penalty if they don't? That proceeded on for 2 years after the law passed in 2010. But on July 28th, 2012, the Supreme Court said, it's the law. Vote was 5-4, but it passed. It's not perfect. No legislation is. But even today, it's purported to be the most important piece of healthcare legislation since the creation of Medicare in 1965, and the most significant piece of civil rights legislation since Brown versus Board of Education in 1954. It has work that needs to be done, and that's why, as mayors, governors, on the local level, it's up to us to fix it. Representative Hagler, all of these folks are fighting for you to fix it so it works for people in Georgia. And that clearly is the task ahead of us now. The bill is 5 years old, but it's 2,700 pages. It's not just about insurance reform. And after it passed in 2010, I read the 2,700 pages. My friends say I need to get a life. But I did it because I was confused like all of you were. And I kept hearing the media and people saying how bad it was and how negative it was and how it's going to destroy this country and all kinds of negative things. I said, well, this man can't be that dumb. Let me read this thing. And I learned a lot. I learned that most people are uninformed and the rest are misinformed. And the media, unfortunately, has had a great part in making that debacle. So it's complex and it's confusing. Well, so it's the healthcare system. I'm just going to go through with you the 10 titles of the law. Only the first section deals with insurance. That's it. Only about 400 pages. The next section talks about Medicaid and Medicare. Third section talks about improving quality and efficiency of healthcare. That section wasn't even written by the president. It was written by the people from the Mayo Clinic. He didn't even write it. Then you go to the next section about prevention of chronic disease, diabetes, hypertension, cancer, all the things that kill us the most. Very detailed about how to make that better. And then there's a section about the workforce. We don't have enough doctors. And there's all kinds of things in this law to help loan forgiveness for physicians who decide to serve in an inner city. And scholarships for young people to get into healthcare professions beyond doctor and nurse. So it's in this law. The next section talks about transparency and program integrity, accountability. We talked about that yesterday. And it goes on to improving access to drugs. Lord knows those drugs cost a lot. But it has provisions in there to reduce the price of drugs. Community health workers. More money so you can stay at home and live with the dignity of your family if you're disabled or elderly, instead of going to an institution. They don't know we don't send our folks there anyway, but because we'd rather take care of them at home. Oh, this is the great part. 93 pages on how we're going to pay for all this. Very detailed. And certainly the last part of it talking about strengthening our healthcare system. So you see, it's not just about insurance. So when people try to repeal this over 60 times, I'm not sure what they want to get rid of. Because there's so many good things in this law that we have to take advantage of. Well, here's the basic requirement. Everybody in this country has to have some form of health insurance or pay a penalty. Well, that's rubbing a lot of people the wrong way. So, well, I can't even pay insurance. Now you're going to pay me a penalty? Well, there are exceptions to that rule, but that's the basic mandate. Because if we all don't have coverage, it's not going to work for everybody. So young people, even those who are not ill, have to be in the system. But here's what the law says. Any insurance company must cover these 10 categories in some way, shape, or form. That's a given, whether you buy insurance on the marketplace or whether you have your own private choice. That's never been done before. He's leveling the playing field in terms of insurance reform so that we all get the same thing. And then so many free tests. Whether you're in the marketplace or not, you can get these tests without copay, without co-insurance, if you need them. You can walk in and get a mammogram, colonoscopy, number of tests for women, for children. That's in the Affordable Care Act, free. Now people say, well, nothing free. Well, I'll show you later on who pays for that, but it's not coming out of your pocket. And then when we talk about not being dropped, how many people get sick, try to get insurance, and they're denied coverage? Well, they get sick and their premiums are increased. Or they get sick and they're dropped. And now that's against the law because of the Affordable Care Act. And women, insurance companies were charging women premiums 125% higher than men. We got a lot of plumbing, so I guess they figured that goes. We got to pay a lot. That's called gender rating. That's now against the law. Equal payment of premiums. And here's a real good one. Any premium you pay, 80 to 85% of it has to go for your direct medical costs. No more for high CEO salaries, no more for bonuses, no more for expensive promotional campaigns. And if they don't spend that money on you as an aggregate, you get a rebate. All right. Rebates go out every August of the year for companies that don't spend enough money on your care. Can I hear an amen? Amen. That's the law. Then when you think about our young people, now you can stay on your parents' policy till the age of 26. They've been the big winners in the Affordable Care Act. 4 million young adults in this country now have coverage who didn't have it before. So you can go to school, you can work some of these low-paying jobs and still have health coverage. Fines for hospitals. If you go into the hospital, and you have your treatment, you come home, and you go back in less than 30 days, the hospital is fined. Because perhaps they didn't explain to you enough what you needed to do when you got home. So hospitals aren't too happy about this way because they've got to retrain their whole staff. My sister-in-law just successfully, thank God, finished treatment for uterine cancer. She got home, and the surgeon called her, the head nurse called her, the social worker called her. She goes, Sheila, these people are so nice. I said, I think they don't want you back. And they may very well be nice too. But that's the patient protection part of this law. So you got to explain to folks, you know, when the days when you go in and have a baby and you're out by noon? Talk to you. What are you supposed to eat? When are you supposed to go back to the doctor? When are you supposed to take your medicine? So that you don't come back. Because hospitals were resubmitting claims for those readmissions and making more money. And you're still sick. That's now against the law. Increased Medicaid patients. Doctors have never liked to treat poor folk. And so this law increases payments to doctors who serve Medicaid patients by 71% over the next 5 years. And you know money talks. So these doctors now are more willing to serve poor people. Medicare is not going out of business. That was one of the strongest arguments in the media, that they're going to run out of money. Not true, it's just strengthened. Free annual wellness visit, 50% off brand name drugs, 18 to 20% off generic drugs. It's in this law for our elders and our seniors. Veterans, whole section on helping veterans when they come back who are broken physically and mentally and spiritually. That's now in the law. Returning citizens, you know who these folks are? People coming back into the community from Department of Corrections. They never had the chance of getting health coverage before. We know how many need help with substance abuse, addiction issues, or emotional problems. Coverage for them is in the law. I spoke to 300 nonviolent offenders in Newark, New Jersey, most of them black and brown brothers, and they sat and listened to me for 3 hours and came up and said, I want that information. I want to give it to my baby mama. I don't care about her, but you got my baby that needs insurance. So they want information. It's in this law. Then when you take a look at the healthcare force, it's always been that physicians could get loan forgiveness for medical school loans because if they're serving in an inner city. But this law puts in $1.5 billion more for scholarships and loan forgiveness for any physician, regardless of the color, who wants to serve in communities of color. You enroll into the Affordable Care Act once a year. And we know it was a horrible beginning in terms of the website crashing, all kinds of difficulties. Clearly, most of those problems have been sorted out. But that's the time when you start preparing. The next enrollment, does anybody know when it is? November, exactly. So November is the time. You can start now by figuring out what you need. But you don't all have to pay a tax penalty. Some people are exempt. And here's the list of the first list of those exempt from paying the tax because of not having enough income, being incarcerated, or a variety of other things. Then about a year into the Affordable Care Act, they came out with another list. These people are also exempt. If you've been homeless, if you've been evicted, if you've got your utilities a threat to having cut off, all of those people, you have to apply for the exemption so you don't have to pay a tax. This April was the first time people paid a penalty for not having insurance, but if they had documentation that their situation fell into one of these categories, they didn't have to pay. Well, who pays for it? It's not coming out of your pocket unless you make $250,000 a year. Those folks are going to have to pay more Medicare taxes. Clearly, anybody that has one of these high health plans, high deductibles with $6,000 deductible, those people will have to pay. Penalties for those who don't get coverage from that tax penalty, and it goes on and on. And this is one I love. People that go to tailor salons are going to have to pay an extra tax. I don't think they're going to buy such a folk here. We can skip that one. And then pharmaceuticals have to pay taxes. Their aggregate sales, they have to give back to the community. So when you hear people say it's going to cost us a lot of money, it's not out of your pocket. It's from reducing fraud, reducing abuse, and making the system more efficient. So what's your family health profile? That's what you have to start with. What drugs do you take? What doctors do you go to? What's your health status? Once you get that, what physicians do you want to see? So that if you do sign up with a plan, you want to keep the same doctor. What clinics or hospitals do you go to? Once you get that laid out, then you can find a plan that meets your needs. Online, in person, mail, or phone. The government spent $84 million on a 24/7 call service where they speak 170 languages. So if you don't want to go see anybody, you can talk to them on the phone. I've used it. I remember having a man in New Jersey who signed up, and he was a white gentleman that had been out of work for 2 years, and he had no health care. He was a truck driver, so he was very nervous about his health. He took 5 meds. I said, well, Tony, let me find out what meds you're taking, so whatever plan we choose, you can get reimbursed for those meds. So he said, okay. I said, well, what drugs do you take? He said, a pink pill, a blue pill. I said, well, that's not quite enough. I need to know the names. So I put him in another room. He called his doctor. He got the names, and the plan we chose reimbursed for those drugs. Okay, so we had his plan all set. He skipped out of the library where I was helping. It took us 45 minutes, but we got him coverage. So clearly, it takes time, but you have to know your health status. And premiums, people say it's going to cost too much, and for some people it will. If you got 6 kids, you smoke, and you don't have any other means, it's going to cost you a lot of money. This plan is not affordable for everybody. Some people are still going to fall through the cracks, but the majority now have access to options that they never had before. Now, every state had a chance. Either they could defer to the federal government, or they could defer to the state to run their marketplace. 27 states said, Feds, you think this is going to work? You run it. Georgia's one of them, and my state, New Jersey, is another one. The other states said, we'll run our own. And because of that, the government gave them significant dollars to do outreach and education and to assist people. Then there are some hybrids of partnerships. Well, clearly that has made a difference. Not many folks when the higher-ups really wanted the Affordable Care Act. And not only did they not want it, they clearly created situations that would obstruct outreach and education. If you want to be a navigator, somebody to assist people to enroll, you have to pass a test like an insurance agent. Very stringent, very difficult, so that limited participation. And then they passed a bill where you just couldn't set up a marketplace, you couldn't advocate for it, you couldn't do anything. So you have limited resources to reach a lot of folks who need this, and that happens in all the other federally facilitated marketplaces. But in spite of that, you made some gains, but I just want to show you a comparison. New York City, where I was born, is a state-based marketplace. They got $400 million from the federal government to do outreach, education, and have people on the ground in the community. A lot of money. This is what Georgia got. Let me go back, sorry about that. Because they decided to let the feds run it. Not enough money in order to do this. And unfortunately, the Supreme Court said, let the states choose. That was not in the original law. The original law said every state run your own. But when they made the states choose, then we had a problem. Then there was Medicaid expansion. Medicaid is for people with low income. And the Affordable Care Act said, well, let's expand Medicaid and go beyond the vulnerable and people who really need the help. Let's open it to a lot more people so that they can get some coverage. Well, 28 states said yes, 19 states said no. And unfortunately, Georgia said no. Not expanding Medicaid. Now, look what they turned down because of not expanding Medicaid. Oh, sorry about that. That's what they would have gotten if the state had agreed to expand Medicaid. Creation of 70,000 jobs. Ms. Salifa, that's what I was talking about. 70,000 jobs would be created by expanding Medicaid and government funding. So obviously, politically, when you hear about complaints about the Affordable Care Act, when you hear about criticism about the Affordable Care Act, I'm going to tell you what I tell church groups, it's not about the plan, it's about the man. Okay. So you now have penalized people who needed coverage, but now can't get it because of political reasons. But in spite of that, you did make some progress. There are over 1 million people who are eligible to enroll, and a little more than half of that enrolled, thanks to your volunteers and your people who are committed to this. And notice what the statistics are, what they pay. Folks now have insurance, but there's a lot of folks, a little over 250,000, who are still left out with no insurance. So, mayors, as you talk to your state legislators and other people, you need to start putting pressure because it's not too late for you to set up your own marketplace so that you get the funds needed to make this work right. There's no doubt about it. There's one lawsuit that they're going to be deciding by the end of the month called King versus Burwell. If you're eligible by income to get a subsidy, the Supreme Court now says, well, we can't give subsidies to the people that are on the federal marketplace. That's not going to work. So they're trying to tear down that part of the law. They know that they can't repeal it, so they're chipping away at it, parts of it. If that happens, there will be over 400,000 people who have been given help by the government to pay their premiums going to be taken away. Did you know that? This was deliberated in March. The decision is going to be made by the end of June. And if it's made against the Affordable Care Act, it's going to be chaos. And none of the folks on the other side of the aisle have come up with an alternative plan if that happens. So definitely, this whole era of healthcare reform is not going to stop. It's going to continue for the next decade in terms of transforming this healthcare system. Most Americans, all the surveys I've read, don't want to repeal it. They just want to fix parts of it. And that's understandable. That's where we have to voice our opinions as to how this is going to work for you and your family here. Now's the time for you to voice those feelings so that you make a change. When I was young, like many of you, I played with these crayons. Many of you did? But I was always confused by that beigey pink crayon they call flesh color. My mother used, I say, what's this crayon for? In 1992, the company that makes these crayons pulled that out of the box, and they now have a group of crayons they call skin tones. And they did it because of the rapidly shifting demographics. That's why the Affordable Care Act is made for you, because it responds to the needs of people of color. Before the middle of the century, 1 out of every 2 Americans will be a person of color or a person of color who speaks Spanish. That's right. So clearly, we are no longer minorities. I don't even use that word. I was in Harlem doing a program with a woman, and this woman before me speaking kept saying minority. She goes, I am nobody's minority. Because it's negatively viewed by our community, uninsured, poor, uneducated. We're people of color, and that doesn't mean pigmentation. That means shared experiences of bias and discrimination. So if a crayon company could adapt to the needs of diverse populations, how much more so should healthcare? There's no question about it. We are growing as a group. We are now either majority or emerging majority populations in most rural and urban centers of this country. Clearly, the so-called majority population is not going to be the majority before the middle of this century. So when you talk about America's health, you're talking about our health. And the Patient Protection and Affordable Care Act is leading us in that direction. Anybody know who this lady is? Well, she was a very prominent black philosopher in the 40s and 50s. And I think her saying is what applies here, because we've got to start thinking about health differently, about wellness, about prevention, about eating right, exercising, spiritually getting ourselves stabilized. Clearly, that's what's important for us before we get sick. But if you do get sick, you have the Patient Protection and Affordable Care Act to be your safety net. Well, I think you know who this is. And she said what I think I'll leave you with. If you always do what you always did, you will always get what you always got. So if you don't like the Patient Protection and Affordable Care Act, do stuff differently. And take charge and control of your health. You can't get a house, you can't get an education if you don't have your health. Mama told me that there are two blessings, good sense and good health. She tried to give me good sense. But good health is up to me. Because quality, affordable, accessible, culturally competent healthcare is not a privilege, it's a civil right. Thank you.
And say hello in Italian. Can you do that?
Buongiorno a tutto il mondo, mi piace molto di parlare italiano, c'è una bella lingua. Bonjour, je m'appelle Sheila Thorne, je suis très contente de vous voir aujourd'hui et de vous partager cette information. Et buenos días, vaya contidos, bon día.
Listen. You there? You need that video. The whole thing was affordable health care.